And just a little background for those listening. In December of 22, the FDA updated the labeling for capecitabine tablets, and the brand name of that is Xeloda. I don't know if they updated that for generic versions of Xeloda, but that was as a result of Project Renewal, and that was an initiative by the Oncology Center of Excellence, which was established by the 21st Century Cures Act that was in 2016 to consider new data and genetic data into its labeling to ensure that these older drugs have the most clinically meaningful, up to date scientific data. As we mentioned, more genetic and genomic data is emerging to inform us. And that's meaningful because, as we talked about, 5FU or capecitabine is a common therapy in colon and rectal cancer, stomach, pancreatic, and other gastric cancers, including breast and ovarian cancer. If there's better data that helps optimize, who benefits from or who may have diminished benefit from these drugs, Karen, I feel there's a fiduciary responsibility of not only the provider but the payers, because it's in the best interest of patients, right? And in 2019, there's a case in Oregon. Joanne McIntyre sued the Oregon Health Science Center after her husband died of excessive toxicity to capecitabine, and they settled out of court. We've been talking about the governing bodies, the leadership bodies. Why have the U.S. regulatory organizations that give guidance to providers like the NCCN and ASCO, why have they not adopted DPYD testing when large parts of Canada and Europe have in its standard practice there?
Yeah, that's the golden question right there. We are knocking our heads around it. It's complicated in the United States, right? We've got the FDA and then the guidelines and Medicare and then private insurance companies. So um, the FDA is waiting for the NCCN to recommend it, and the Medicare and yeah, what when they do it, and the NCCN is waiting for more data. In our mind, we don't need more data, right? Like what the NCCN is worried about is the efficacy if they reduce the dose. And what we say is, well, first of all, there's no data to support that you're going to have reduced efficacy, because if you can only metabolize 50% of something, you shouldn't be given 100%. That I'm not a scientist, and to me that seems very very easy to understand. So if you're so worried about efficacy, but you're going to severely hurt or maybe even kill the patient, well, there's no efficacy in that. They also say that it's rare. 1 in 20 people are DPD deficient. So maybe not as rare as people think. And also, as we talked earlier, it seems that it's rare because it's going unreported. And then the FDA, one of the reasons that they have told us when the citizen petition came out, and then also in conjunction with Project Renewal, is that there's no FDA approved DPYD test. So the problems with that is it takes a lot of money and time to get a diagnostic test FDA approved. Well, there's not enough, if like 200,000 patients are going to be given this chemo every year in the United States, approximately, that's not enough numbers for a company to warrant spending the time and money to get a diagnostic test FDA approved. I did see something in the news that a company just nationally launched an FDA approval for a huge cancer test that has DPYD in it. So I've asked, is that an FDA approved drug or a diagnostic test now? But I haven't heard back from the people at the FDA who I've been speaking to at the Oncology Center of Excellence, and I don't know if that's because of what's happening right now
Yeah.
in the government. But from the insurance standpoint, as you made, that they have a fiduciary duty also to protect their patients, is, my mom in 2014, let's say worst case, that DPYD test was $1,000. She spent 2 weeks in ICU, round the clock care. And what we didn't know is we were basically waiting for her to die. What we thought we were doing is waiting for her white blood cell count to recover and she would be able to, heal and get better. But the 5FU obliterated all of her white blood cells. So she was not going to recover. It was basically watching a patient die. But that hospital bill with round the clock, she had 4 or 5 specialists seeing her every day, taking care of her, all the medication, the morphine that they were giving her to, stem off the pain. Um, that was $500,000, all paid by for Medicare.
Yeah. Yes.
So
Okay, that's profound.